Hello, this is Dr. Foy. Today, there's one thing I want us to talk about, and this goes especially to young men, in fact, to men in general. There is this thing called erectile dysfunction. What is erectile dysfunction? It is when a man is unable to get or keep an erection that is adequate or enough for sex. Now, I think recently we've had a lot of cases where you find a young man who is really healthy and active, and all of a sudden you get that this young man just fell and died. Now, we've noticed that if you go back to the past histories of these young men, maybe 1 month or probably some months prior to their death, they were complaining of having poor erection. Now, one thing you need to know is that when you are having poor erection, it may just be an early warning sign that your heart has a problem. So, do not take your poor erections for granted. That may be an early warning sign that your heart is not functioning properly. And if you do not go for a consultation, maybe some months after, you may just fall and die. It is always important to take an erectile dysfunction really seriously, because it's a sign that it may be an early warning sign that your heart has a problem. Some of the risk factors for erectile dysfunction are things like high blood pressure, diabetes, a lot of alcohol. You take a lot of alcohol, you smoke, you are not exercising, you are obese, you are overweight, or you have low testosterone, or amongst others. The aim of this video was to raise awareness that if you are a man and you are having erectile dysfunction, you are not able to have or get an erection and keep that erection which is adequate for sex, please do not take it lightly. It is true that most of the causes of erectile dysfunction are psychological, but it is always good to consult your doctor so that we can rule out a possible problem with your heart. Right, hope this helps. Again, I'm Dr. Foy. When I'm not consulting patients, when I'm not operating, I'm trying to let you know how you can improve your lives and live healthily. Thank you. See you in the next video.